Alright everyone, the lamestream media is still not talking about it because they don't care what happens over in the Congo, but the Ebola epidemic over there continues unabated. There are still new cases. In fact, the number is slowly inclining. It hasn't gone like exponential yet, which means there's still time potentially to tamp down on it. Unfortunately, again, let us remember, you've got several complicating factors involved with this that you didn't even have really in the West African epidemic a few years ago that killed, at least 10, probably 20 or more thousand people. They underestimated the numbers because towards the end people were just taking their dead. They weren't even telling the health workers because they believe that there should be like literal human remains in a grave. The idea of cremation is considered, if not blasphemous, highly disrespectful there. So they were cremating the bodies. Didn't go over too well. They probably should have figured out some sort of compromise. Oddly enough, probably would have saved more lives. Unfortunately, in the Congolese epidemic, it's happening in a war zone. For those that don't know, there's a civil war going on in this region right now between various rebel factions. What's happened, therefore, is that aid workers have been attacked. That can spread the Ebola, number one. It can also, kill off your aid workers, number two. You lose that PhD running, or who's willing to actually volunteer to go running around in a jungle for little or no actual physical reward in order to try to save people. You've lost someone who's highly unique. And so when these happen, they're like, the rebels say, well, that hospital van over there, that would make a nice armored car. We're going to go and shoot these people and take it. Whoops, there's an Ebola patient in the back, but they don't know because they just filled it full of bullet holes, so now they've all got Ebola potentially. It's a really big problem. You've also got the problem of secondary epidemic now, which is a malaria outbreak has happened because of a shortage of chloroquine, which means that the population's overall health is deteriorating in some areas. That leaves them more susceptible, unfortunately, to other infections, including the Ebola. I believe there was also a story where Marburg had been found recently in bats within the region. Which isn't surprising, it's endemic in various parts of the world. Marburg, no joke either. I think it's basically similar. It's a hemorrhagic virus, although I don't believe it's quite as deadly. I think it's closer to 20%. Ebola, it's a 50-50 proposition. You get Ebola, under the best of circumstances, you've got a slightly better than 50-50 chance of recovering. Unfortunately, even if you recover, you're likely to have long-lasting negative health impacts. This was the case with people who got the plague during the Dark Ages, literally the Black Death. A lot of people complained thereafter of general poor health. Now, children were a lot healthier because they were immunized against that, and then there was lower population density. Serfdom began to end, so that was good. For that generation, they get fucked. Like there was which was the one, the Byzantine emperor? He got the plague, survived. I think his wife died, and he sort of went nuts. And for that on, he had terrible insomnia and became kind of a tyrant at the time. Was it Justinian? I want to say it was Justinian. Unfortunately, with the Ebola epidemic, though, it shows no signs of slowing down. By this point, this many months into the game, in the West African outbreak, they had sort of gotten a hold of it, at least in Guinea. It had spread to Liberia and Sierra Leone. In the latter case, it killed a lot more people, higher density in some of the urban zones. It has now, though, reached Butembo. You'll remember it took a while, a few months from the time that it sort of approached the urban areas from Guinea into points south. In the last epidemic, it took a few months for it to take hold and begin truly burning through the population. Unfortunately, it's already reached Butembo. It's a city of about the size of Boston. Only probably doesn't have as many medical amenities as Boston. So therein lies a problem. It's reached an area, therefore, in which you have trade and travel, you have enough population density to sustain a significant epidemic, at least locally. The problem is people will flee from that. They'll be infected, they'll flee, they're fleeing warfare, whatever. They spread it to some other town. They may even go across national borders. You got to remember that this is very, very close. This particular province borders, Rwanda and the Sudan? No, not the Sudan. I don't know. I'm fairly good at geography, but a lot of countries clustered in the area around that region. It could go further quite easily, unfortunately. It could enter East Africa. It could go to South Africa. Can you imagine if it hits like Johannesburg? You've also already got a looming genocide down there anyway. Then people start, dying of Ebola. I think it'd be the worst thing in the world. Also, keep in mind, again, you have these other various diseases. The medical community has had trouble anyway keeping them down, let alone in an Ebola zone. It's a little different. If it's, you've got malaria. You're trying to take care of malaria. Okay, put up the mosquito nets, take your chloroquine, whatever, everything's good. Ebola requires something different. Full body hazmat suit. Wear that out in a jungle. It's 90 degrees, full humidity, and you're wearing a full cover suit. Yeah, it's going to be misery. A lot of people probably don't even take proper precautions because of like, oh my god, I'm taking my hood off. I can't stand it anymore. It's like if you're working in Florida at fucking Disneyland or whatever and you have to wear the Mickey Mouse costume. Can you imagine how sweltering that is at the end of your shift? Probably not very much fun. Unfortunately, with the world not really focused on this, there was a lot of fundraising going on in the last big Ebola epidemic. Haven't seen anything about it this time. Probably because it's in more remote an area. It's not in West Africa, which is a little bit more sort of connected to the world. This is in the middle of the Congo. I have to say, probably thousands will die before the world really takes notice. Unfortunately, we've seen this. The world, it's all the globalist people. They want to micromanage and focus on every other aspect of the world order other than human disease. It's like Bill Gates is the only one that does it, and then he alienates people because he talks too much about vaccines, and there's like anti-vaxxers and stuff. By the way, vaccines mentioned in that the receipt book that I mentioned previously, fucking get vaccinated. You don't need like the flu vaccine probably, but if you're trying to keep your kids from like the mumps and rubella vaccines, you're fucking crazy. I hate to say it, but you're fucking nuts. I got those vaccines, look at me, I'm just fine. That's about all. Peace out.